15.2 Introduction. If you come to know that your friend is having HIV/AIDS, what will be your attitude towards him? You have an old person living in your neighbor. What perceptions and beliefs do you have about him? One of your family members is suffering from a terminal illness such as cancer. What kind of attitude will you have towards her? Your friend has suffered a trauma recently. How will you interact with her? The above instances indicate that one needs to have awareness and understanding of the issues and concerns of such people so that we can interact with them effectively and take proper care of them. So these can be described as special population who have common issues of universal significance. Special population is comprised of marginalized members who are highly sensitive and susceptible to many hazards and prejudices like gender, age, occupation, illness, substance use, etc. They are considered the most vulnerable part of a society. In this unit, we will learn about special population, i.e. geriatric, HIV/AIDS, terminally ill and traumatized populations. We will try to understand some commonly associated psychological disorders with these populations. By the end of this chapter, you will be able to acquaint yourself with a basic knowledge about the management goals, some common types of counseling techniques and barriers associated with the counseling in special populations. 15.3 Geriatric counseling. Geriatric counseling refers to counseling provided to older persons or those who are in the late adulthood stage of life. The word geriatric is derived from a Greek word called geron, which stands for old man. From a developmental perspective, the old age is divided into 3 stages: the young old, 65 to 75 years, the old, 75 to 85 years, and the old, 85 years and above. Older people in the first 2 stages are usually active, though it is a little lesser for the second stage. However, the third stage is usually marked by decline, but the rate may vary for individuals. As per a recent survey, total 727 million people who are 65 years old or above reside across many corners of the world. According to the population census, nearly 14%, 104 million, of total geriatric population of the world reside in India. It also predicts the older population to become 20% of the total population in India by 2050. With an increased lifespan, they are vulnerable to physical and psychological problems, though it also depends to some extent on the kind of life and their health status prior to the late adulthood stage. Several facilitating factors impact the health of the aged in a positive way, such as healthy behaviors, supportive physical and social environment settings, state of congruence among ideal and real self, roots and bonds /relations to the ethnic and cultural backgrounds, supportive familial environment, etc. However, if such facilitating factors are absent, then physical as well as psychological impacts are seen in old ages, due to which critical care and management of elderly becomes a challenging task for mental health professionals. 15.4 Problems related to mental health in geriatric population. 15.4.1 Psychological changes in older people. In general, older people are viewed in a negative way with regard to their abilities and functioning, that there is loss, disabilities and dependency. However, it may lead to prejudices, discrimination, and marginalization of older people. Hence one needs to be aware that older stage is not always associated with debility and disability. As per Erikson's theory of human development, late adulthood stage is characterized by the challenge of ego integrity versus despair. If the older person has achieved all the developmental milestones at each of the previous developmental stages, he is satisfied and has a sense of fulfillment. However, if S/he has not achieved things, is not able to adjust with the changes in her/his life, and is not able to have a sense of meaning in their life, it may result in despair. There are certain common changes that occur in geriatric population like decline in the memory, cognitive functioning, difficulties or problems in vision, hearing, walking, all physical changes which may result in decreased independence, low self-esteem and self-worth, increased vulnerability of being marginalized and physical or psychological abuse, inability to change with the continuously changing environment, decreased sleep or sleep-related problems like insomnia, increased social isolation, and increased frailty. Thus the changes can be in physical and psychological, cognitive, affective and social aspects. There is also the changes brought about by retirement, loss of spouse, abuse etc. which affect their mental well-being. The changes are not always negative. The older stage is also marked by positive changes. The older people gain in experience and wisdom. They have more leisure time to pursue their interests and passions. They revel in being grandparents and enjoy getting facilities and discounts. Further, the older people also elicit care and respect from the family and the society because of their age. Aging is thus marked by both positive and negative transitions and transformations. 15.4.2 Common disorders in older population and their assessment. Geriatric people go through many changes as a part of aging, but sometimes these changes may lead to the development of geriatric syndromes. These syndromes can be further subdivided into two broad areas: physical diseases, vision and hearing problems, body aches, osteoarthritis, chronic obstructive pulmonary disease, COPD, diabetes etc. Psychological disorders, depression, anxiety issues, paranoia, loneliness, may contribute to the empty nest syndrome, dementia or Alzheimer's disease, the most common reason for a decline of the cognitive functioning, etc. Assessment. The diagnosis of psychological issues in geriatric population requires expertise in the respective area. Sometimes it is a challenging task to differentiate between normal changes due to aging and the presence of an actual disorder. Various tools are used by the counselors in clinical settings for making their assessment more sensitive and efficient, like in-depth clinical interviews, structured, semi-structured or unstructured, validated psychometric tests like questionnaires, and neuropsychological evaluation. Clinical interviews. Clinical interviews are special form of interviews used to gather information about the current mental status, marital discords, employment status, substance use, etc. The counselor must have a good command over his communication skills. Clinical interviews can be of three types. 1. Structured interviews. A structured interview includes asking certain questions in a predefined sequence. Counselor sticks to the sequence and doesn't take any detours. This increases the sensitivity of structured interviews in terms of their reliability and validity. 2. Semi-structured interviews. In semi-structured interviews, some specified questions are asked during the assessment phase, but deciding the sequence is in the hands of the counselor. As per the feasibility, other dimensions of the problem can also be explored. 3. Unstructured interviews. In unstructured interviews, counselor decides the topics, themes and questions to be asked during the session. Generally open-ended questions are asked. No predefined fixed pattern or set of rules are there to be followed. Psychometric tests. Psychometric tests are structured, reliable and valid tests used for assessment of cognitive decline, memory loss etc., and psychopathology, depression etc., in geriatric population. Various types of psychometric tests are available which can be used on geriatric population, like MMSE, Minimental State Examination, for the assessment of cognitive functions. Dementia Rating Scale. DAS, Depression, Anxiety and Stress Scale. Geriatric Depression Scale. Neuropsychological Evaluation. It is a comprehensive and systematic assessment of the functioning of the brain in relation to human behavior. It aims at studying cognitive functions of individuals and their relationships with resulting behaviors. Thus it is not limited to studying only brain injuries or organic damage of the brain, but also assesses healthy brain functioning of individuals with psychotics or other disorders. It differs from both neurological evaluation, which is done generally bedside, and standardized psychological assessment, which is done to diagnose psychiatric conditions marked by abnormality in behavior, mood, thoughts and personality. Neuropsychological assessment is also different from neuroimaging, which is done by using MRI or CT scan. Neuropsychological assessment usually includes assessment of all the four lobes of the brain and several areas like attention, executive functions, memory and learning, information processing, problem solving, motor functions, ataxia, etc. Diagnosis in neuropsychological assessment. Neuropsychological assessment follows a hierarchical protocol to get a complete picture about the problem. It includes the following steps: history taking. It includes medical and / or psychiatric history of the patient, information about developmental milestones, psychosocial history, etc. Interviewing. Psychologists use three types of interviews: structured, unstructured or semi-structured interviews in order to get a picture about the problem that patient might be experiencing. These interviews include many tools like mini mental state examination, MMSE, and impairment scale. Standardized tests. Standardized tests are the measures which contain specified items arranged in a predefined manner to get a valid and a reliable score for the performance of the patient in comparison to the normally distributed population. Few commonly used standardized measures are Onemhan's Neuropsychological Battery, OPGI Battery of Brain Dysfunction, PGIBD, Wechsler Intelligence Scale for Children, WISC, Wechsler Adult Intelligence Scale, WAIS, Thus, neuropsychological evaluation is an effective way to assess the brain functions on the given tasks, to quantify the impairment and to formulate effective treatment plans, for example cognitive retraining, to increase the rehabilitation potential of the elderly. 15.5 Goals of Counseling in Geriatric Population. Counseling in geriatric population is intended to address cognitive decline and / or psychological problems like anxiety and depression, and adjusting with the physical changes. Since it is a specific stage of development with unique issues and concerns, most counselors interested in working with the aged need additional professional training in this specialty. They need to have awareness about the general concerns of the older people. In India, decrease in joint family system, migration of the younger generation to bigger cities and outside the country, economic constraints, ill treatment of the elderly, abuse etc. make the aged vulnerable to psychological problems. Some of the anticipated outcomes of counseling are behavior change, coping skills, ability to make decisions, improvement of the interpersonal relationship, and enhancing motivational levels. 1. Behavior modifications in geriatrics. With advancement in age, the ability to adapt with the environmental changes reduces up to a certain extent, which poses many problems. Sometimes, some peculiar behaviors may become problematic in nature and they can disturb the client or their loved ones attached with them. However, with the help of some behavioral modification techniques in geriatric counseling, problematic behavior, can be changed. 2. Enhancing coping skills. Dysfunctions due to old age cause problems in dealing with real-life problems. An inability to cope with these dysfunctions further increases distress and anxiety levels. Their management is essential to prevent any psychological damage to the client. Counseling helps in learning new adaptive coping skills like being assertive in nature, selectively attentive to external cues, adopting effective strategies. 3. Ability to make decisions. Sometimes, clients face difficulties in decision-making due to their cognitive decline, personality traits or codependency. Counselors can help improve their cognitive functions and rebuild their self-esteem for decision-making. 4. Improvement of the interpersonal relationship. Interpersonal relationships give a sense of worth and meaning to the life, and increase the level of happiness. Counseling aims towards helping the elderly to form quality relationships with their family members or people associated with them like friends. 5. Enhancing motivational levels. Reduced levels of motivation are responsible for consistent failures and low self-esteem. Therefore, counselor helps in improving levels of motivation so that the road to recovery becomes smoother. The elderly are also put sometimes in the old age homes due to various reasons like being alone, inability of family members to take care of them, or disability etc. Rehabilitation programs for the old age aim at helping the older people be self-sufficient to the extent possible, improve the overall quality of their life, making their life more meaningful. 15.6 Commonly used counseling techniques in geriatric population. Geriatric population is more prone to many types of psychological problems. These problems are responsible for disturbed psychological, physical and social functioning. Geriatric counselors are concerned with resolving psychological issues by using various rehabilitation or counseling techniques. Counseling is conducted in mainly two settings, individual or group for the management of psychological problems in geriatric population. Individual counseling. It includes certain number of personal sessions given to the client while maintaining confidentiality about what client shares with the counselor. They generally share their thoughts, feelings and experiences during the session. Group counseling. This form of counseling includes the formation of a supportive group in which clients having similar needs and relative life experiences are enrolled. Supportive groups provide an opportunity for mutual interactions between the group members that can help in discussing many daily life problems and challenges and provide two-way communication for finding their solutions. Certain specific counseling techniques are described below. Cognitive behavioral therapy, CBT. While working with depressive clients, Aaron T. Beck developed CBT in 1970s. It is used for the management of mild to moderate anxiety, depression, stress and insomnia etc. CBT emphasizes interrelationship among cognition, emotions and behaviors as they affect each other. It is assumed that mood and behaviors can be determined on the basis of perceptions and interpretations of events into one's life that may be responsible for a particular thought. These thoughts are automatic in nature. They generally arise from dysfunctional beliefs. CBT targets these beliefs for changing one's behavior, which is commonly regarded as cognitive restructuring. Cognitive impairment in geriatric population makes the process of treatment a challenging task for the counselor. However, modified techniques of CBT have been used effectively in the treatment of depressive symptoms in elderly people. Reminiscence therapy. Reminiscent and life review counseling has been developed especially for the treatment of dementia in geriatrics. As the name suggests, this may include recalling and re-experiencing of major events and rebuilding perceptions related to them. The counselor tries to slow down the process of forgetting of the client due to dementia. Several techniques can be used like storytelling, showing photograph or stimulation of sensory organs with the help of external cues like touch, sound, and smell. For increasing its effectiveness, the counselor may use it in combination with cognitive or behavioral approaches. Reminiscence therapy has been shown to be effective in increasing satisfaction levels among geriatric population. Interpersonal counseling. It is intended to treat mood disorders such as depression. Main goal of this technique is to improve interpersonal relationships by reducing any form of distress in an empathetic way. For this purpose, the counselor helps the client to become aware of his/her affected relationships and problematic thoughts responsible for them. The counselor also helps the client in developing problem-solving and communication skills for the improvement of psychosocial functioning. Brief interpersonal counseling is another evidence-based approach which is generally used for resolving role conflicts and recovery from the major depression. Gestalt therapy. The basic aim of this type of counseling is to make people aware about various kinds of conflicts and ambiguities due to intra or extra-environmental cues. It emphasizes on teaching people about their personal responsibilities, and focusing on present contexts rather than digging out the issues from older times. It also helps geriatric clients to respond fully and reasonably to various environmental factors in their surroundings. Points to remember: geriatric counseling. The word geriatric was derived from a Greek word called geron, meaning old man. The population census predicts the older population to become 20% of the total population in India by 2050. If facilitating factors are absent, then physical as well as psychological abilities to perform effectively declines drastically with the age. Changes occurring in geriatric population are decline in the cognitive functioning, decreased efficiency of biological systems, loss of independence, increased vulnerability, inability to change with the environment, sleep-related problems, increased social isolation, and increased frailty. Geriatric syndromes are of two types: physical disorders and psychological disorders. The diagnosis of psychological issues in geriatric population can be done by clinical interviews, structured, semi-structured or unstructured, validated psychometric tests and neuropsychological evaluation. Goals of counseling in geriatric population: behavior modifications in geriatrics, enhancing coping skills, ability to make decisions, improvement of the interpersonal relationship, enhancing motivational levels, building congruence. Counseling is conducted in mainly two settings, individual or group, for the management of psychological problems in geriatric population. Commonly used counseling techniques in geriatric population: cognitive behavioral therapy, reminiscence therapy, interpersonal counseling and gestalt therapy. Cognitive behavioral therapy. CBT emphasizes interrelationships among cognition, emotions and behaviors. CBT targets these beliefs for changing one's behavior. Reminiscence therapy include recalling and re-experiencing of major events and rebuilding perceptions related to them. Storytelling, showing photograph or stimulation of sensory organs with the help of external cues like touch, sound, and smell. Interpersonal counseling. It is intended to treat mood disorders such as depression. The counselor helps the client in developing problem-solving and communication skills. Gestalt therapy. It aims to make people aware of their conflicts and ambiguities due to intra or extra-environmental cues. It emphasizes on teaching people about their personal responsibilities, and focusing on present contexts rather than digging out the issues from older times. 15.7 HIV/AIDS counseling. HIV, human immunodeficiency virus, is a retrovirus that infects T lymphocytes, CD4 cells, in our body. These cells are responsible for activating our immune system. Once HIV enters into the system, it targets CD4 cells and starts killing them. This results in decreased immunity levels, which further opens a window for other types of infections, opportunistic infections, like tuberculosis and pneumonia. It is known as acquired immunodeficiency syndrome, AIDS. So AIDS itself is not a disease but a cluster of diseases. Currently there are about 2.1 million people in India who are struggling with HIV/AIDS. As per a recent survey report, the overall prevalence of AIDS is declining in our country due to the continuous efforts of many governmental and non-governmental organizations like National AIDS Control Organization, NACO. But a steep rise in prevalence of AIDS was seen in some states like Andhra Pradesh in comparison to national data. Some common factors responsible for the contraction of HIV/AIDS: unprotected sex, maintaining sexual contact with multiple partners or polygamy, illicit injectable drug use, using needles or injectable drugs like smack, transmission of virus from infected mothers to child during pregnancy or during breastfeeding, etc. Major depressive disorders, bipolar disorders, substance use disorders, severe levels of stress and anxiety, suicidal ideation, and neuropsychological impairment are most commonly seen psychological disorders in the patients suffering from AIDS. These psychological comorbidities are also responsible for low self-esteem, increased risk-taking behaviors, which in turn affects the psychosocial functioning of an individual. An overall reduction in the quality of intimate relationships is often seen in the patients of HIV/AIDS, which makes them emotionally fatigued and thereby leaves them in a vulnerable state. 15.8 Goals of counseling in HIV/AIDS. Psychosocial functioning. In HIV/AIDS counseling, the entire focus is laid on betterment of the psychosocial functioning of clients by reducing their agony, pain and suffering. To increase the efficiency of pharmacotherapy, HIV/AIDS counseling is often used in combination to pharmacotherapy to enhance its efficacy. To reduce the impact of social stigma, due to marginalization, clients may develop anguish and antisocial behaviors. They may also develop loneliness, guilt feelings and have suicidal tendencies due to stigma. Counseling helps in reducing the impact of stigma. To reduce frequency of dropouts, non-adherence to medical treatment and frequent dropouts from the counseling sessions is quite common in such clients. Counseling aims towards decreasing the dropout rates and rebuilding self-esteem in clients. Reduction of further transmission. One of the goals of counseling is prevention of transmission of the disease, as in pre-test counseling, and providing a support to the sufferer, post-test counseling, for reducing the likelihood of any psychological comorbidity. 15.9 Commonly used counseling techniques in HIV/AIDS. Client-initiated counseling. As the name suggests, client initiate and seeks the intervention for reducing emotional conflicts and distress. He/she could be stigmatized and may be in a distressed state. This should be taken as a distress call by the counselor, and the counseling must be initiated on an immediate basis. Provider-initiated counseling. Here, the client is referred by physicians or any organization that he/she may be associated with. Recommendation about the HIV/AIDS testing is also made in the case of antenatal care. There could be various prejudices and stigmas attached to the HIV/AIDS testing. Thus, counseling for reducing these prejudices must be the first priority of the counselor. Pre-test counseling. Often, clients are in a dilemma about HIV testing. In pre-test counseling, Counselor provides precise and up-to-date information about the transmission and prevention of this disease and other sexually transmitted infections, STIs, so that client can make a sound decision about the testing procedure. Information about the window period is given to the client, which is about 12 weeks between the testing period and last HIV exposure. During this stage, counseling skills of a counselor are very important in establishing a good rapport and assessing whether how many post-test sessions are required. It also includes early identification of clients at high risk, such as injectable drug users, IDUs. Post-test counseling. It involves handing over the results of HIV testing. The process must be simple and should be carried out in person so that confidentiality can be maintained. The role of counselor is of prime importance during this phase, as he can redirect the client and remind about the coping strategies required for settling down with the required information. If test results are positive, then the client must be provided with a thorough knowledge of transmission, safe sex practices, psychosocial impacts of the disorder and future implications associated to it. Overloading with the information must not be done, as it increases distress and anxiety levels in clients. On the other hand, if the results are negative, then clients must be provided education about risk reduction strategies. There must be provision in the counseling to reinforce the client about managing themselves better and follow healthy lifestyles to prevent any STIs in future. Crisis intervention. Crisis intervention includes assessment of the problem to provide an immediate solution. This is a short-term intervention plan to resolve emotional, physical or psychological problems in clients. It also includes helping the client to develop help-seeking behavior during their crisis. Counselor encourages clients to get support from his/her closed ones so that the crisis can be easily dissolved. Counselor also tries to help the clients to develop better coping strategies for current and future problems. 15.10 Special scenarios in HIV/AIDS counseling. 15.10.1 Counseling of children with HIV/AIDS. Counseling helps children in deciding their future goals, understanding the impacts of the disease, addressing stigma attached, transmission of HIV/AIDS, course of treatment, etc. This reduces anxiety among them and develop a feeling of perceived support. Counselor must consider the age of the child and their understanding of the disease while providing counseling. It helps in formulating better intervention plans. Various support systems help to decrease the overall impact of social stigma, discrimination and resentment because of being neglected. Further, therapies like family therapy, play therapy and behavior therapy address the fear, anxieties, conflicts and uncertainties in children and adolescents as well as their parents. 15.10.2 Counseling of pregnant women. To motivate pregnant women for HIV testing, especially in their antenatal phases, is the main task for the counselors working with women. During initial stages of counseling, the counselor tries to assess needs, knowledge levels and information gaps of the client. HIV seropositive pregnant women undergoing antiretroviral therapy, ART, must be given information about its impacts on the growing fetus. Counselor tries to impart some knowledge about ART that may help in reducing any complications. It also helps in terminating unwanted pregnancies. 15.10.3 Couple counseling. HIV testing can lead to various misunderstandings between partners. These can lead to violent behaviors against each other, which often results in physical abuse. The main goal of counseling is to reduce such risks and help in establishing a healthy and respectful relationships among partners. Premarital counseling can also be used to remove any dilemmas attached to the prevalent notions about HIV/AIDS. 15.11 Common barriers associated with HIV counseling. HIV-infected clients are more prone to secondary infections due to an overall reduction of the immunity. To slow down the decline of immunity, they are put on medicines which again act as a constant reminder about their infection. Furthermore, the side effects of such medicines may cause problems in their daily life functioning and thus, may affect their state of well-being. They may develop anxiety, depression and frustration. Some people also develop guilt while cursing their sexual acts with multiple partners, orientation like being gay or lesbian, injecting drugs, or feeling about being punished due to their choices/actions. These reactions may be associated with the mortality due to HIV/AIDS, losing hope for available treatments, isolation or abandonment, fear of social rejection, and lifestyle modifications as per the ART. All these factors may lead to early dropouts or non-adherence to the counseling and medical treatment. Counseling for HIV/AIDS can be done on an individual basis and or along with their partners or families. The aim of counseling in this stage is prevention of any further chances of infection, providing an effective care to the client, and helping him/her to develop better coping strategies to deal effectively with the barriers causing hurdles in the process of treatment. Points to remember: HIV/AIDS counseling. HIV is a retrovirus that infects T lymphocytes, CD4 cells, in our body, resulting in a cluster of diseases called AIDS. Some common factors responsible for the contraction of HIV/AIDS are unprotected sex, maintaining sexual contact with multiple partners or polygamy, illicit injectable drug use, and transmission from infected mothers to child. Psychological disorders associated with AIDS are major depressive disorders, bipolar disorders, substance use disorders, severe levels of stress and anxiety, suicidal ideation, and neuropsychological impairment. Goals of counseling in HIV/AIDS: psychosocial functioning, to increase the efficiency of pharmacotherapy, to reduce the impact of social stigma, to reduce frequency of dropouts, and reduction of further transmission. Commonly used counseling techniques in HIV-infected clients: client-initiated counseling, provider-initiated counseling, pre-test counseling, post-test counseling, crisis intervention. Client-initiated counseling: client takes an initiating step and seeks the intervention for reducing emotional conflicts and their resolution. It should be taken as a distress call by the counselor, and the counseling must be initiated on an immediate basis. Provider-initiated counseling: a referral is made by an individual, for example physicians, or any organization for the intervention. Counseling is given to reduce associated prejudices. Pre-test counseling: counselor provides precise and up-to-date information about the transmission and prevention of this disease and other STIs so that client can make a sound decision about the testing procedure. It also includes early identification of injectable drug users, IDUs. Post-test counseling: the process of handing over the result of HIV testing must be quite simple and should be carried out in person to maintain confidentiality. If test results are positive, then the client must be provided with the knowledge the transmission, safe sex practices, psychosocial impacts of the disorder and future implications of HIV/AIDS. Crisis intervention: it includes assessment of the problem, understanding about the current problems and supporting clients for making a decision to solve them. Counselor tries to help the clients to develop better coping skills to deal with their problems. Counseling of children with HIV/AIDS: It helps children in deciding their future goals, understanding the impacts of the disease, addressing stigmas attached to HIV/AIDS. Support systems and therapies like family therapy, play therapy and behavior therapy used for decreasing the impact of social stigmas, discrimination and resentment. Counseling of pregnant women. Women are least motivated to opt for HIV testing, especially in their antenatal phases. Counseling tends to enhance their motivation levels and imparts knowledge HIV/AIDS. Couple counseling. HIV/AIDS testing can lead to various misunderstandings between partners. Counseling helps in the establishment of a healthy and respectful relationships among partners. Barriers. There are many barriers in the path of HIV counseling. These are side effects of such medicines, non-adherence to drug regimes, psychological reactions like anxiety, depression and frustration, social stigmas, etc. 15.12 Counseling in terminal illness. A terminal illness can be described as a disease which is responsible for reducing the lifespan of an individual who may live up to a few months or even a few weeks. The experience is quite traumatic for the individual as well as for loved ones associated with him/her. Terminal illness like cancer causes disturbances in the daily routine and exposes the sufferer to certain odd experiences which might become unbearable at times, like chemotherapy, radiation therapy, and surgery for instance. People with terminal illnesses start developing psychological problems like depression, anxiety, anger and frustration. Counseling helps in providing a relief from the pain, sleep problems, fatigue, depression, anxiety and stress. It is to be worth noting here that most of the counseling techniques developed for the terminally ill clients focus on their needs, physical, psychosocial, emotional, spiritual, and practical needs, that may arise during their terminal stages of illness. Some basic interventions like psychoeducation about the terminal disease can be beneficial. The supportive care focusing on terminally ill must be appropriate, realistic and practical in nature respective to their age groups and severity of the illness. Terminally ill clients generally try to seek answers like, why is this happening to me? Had I done any kind of sin? What kind of punishment am I bearing? Is God really fair to me? The main task of the counselor is to help clients to develop a sense of worth and add meaning to their lives. Counselor plays an important role in the salvation of such clients and prepares them for their journey towards their death by lessening their pain and agony. However, before discussing various types of counseling techniques used in terminal illnesses, let's have a look at various types of reactions shown by a dying person or the family members. This will help us to develop better understanding about various aspects of the counseling techniques. 15.13 Psychological reactions shown by terminally ill people. Kubler-Ross proposed stage model for explaining psychological reactions shown by a dying person. Denial. It is the first reaction shown by the client. The client in this stage denies about the terminal illness and discards that there is any problem with him. Anger. A lot of anger and frustration develops during this stage, which are associated with the feeling of injustice. Bargaining. This is the third stage in which the terminally ill client tries to bargain for his life and starts worshipping and promising to the God for delaying his death or prolonging his life and forgiving his sinful deeds. Depression. It is the fourth stage where the client is overwhelmed with the loss, hopelessness, sadness and guilt which is accompanied by the grief. Acceptance. This is the final stage in which the client finally accepts the terminal illness or death as an inevitable event and gets ready to face it. Several researchers working with terminally ill clients have stated that the trajectory is somehow flexible, and it is not necessary that these stages may come one after another. There are many variations, but the psychological reactions shown by the terminally ill clients are somewhat same as mentioned by Ross. Now let us discuss the main goals of counseling in terminally ill patients. 15.14 Goals of counseling in terminally ill patients. To provide a thorough knowledge about the disease and associated physical and psychological symptoms. This helps in getting more knowledge about the transitions in one's body and mental processes. To help the clients in venting off their emotions, anger, and reducing the state of frustration and irritation. To support the client for maintaining the quality relationships and preventing any decays into their psychosocial functioning. To make them aware about the fact that death is inevitable and the ultimate truth. One of the major roles played by the intervention is to accept this fact and start enjoying the remaining time they have with them. To help them getting a relief from their guilt proneness and making them to look for more brighter side about their lives and their achievements. Now let's learn some common types of counseling techniques which are developed especially for improving the condition of terminally ill clients. 15.15 Commonly used counseling techniques in terminal illness. Grief counseling. It is also known as the bereavement counseling. This form of counseling aims to help the client to cope with potential losses which may evoke physical, emotional or cognitive reactions and develop an understanding about internal conflicts. It is believed that there could be several ways to experience grief, such as detaching oneself from social activities, developing anger, frustration and agony, etc. The intensity of the grief depends on the type of grief and the associated loss with it. There could be many types of griefs, among which normal, anticipatory, complicated and disenfranchised griefs are commonly seen among terminally ill clients and their family members. 1. Normal grief, natural experience of the actual loss which is accompanied by some emotional and physical reactions which may be reduced with time. 2. Anticipatory grief, it includes experiencing the loss before the actual one. For example, anticipation about the death when an individual is diagnosed with a terminal illness like cancer. 3. Complicated grief. This is a morbid form of grief which is most commonly seen among primary enablers in a family on losing a closed one. It becomes chronic, due to which the person develops some maladaptive coping styles like substance use disorders, suicidal tendencies, risk-taking behaviors, etc. 4. Disenfranchised grief. This is a hidden or latent grief which is not shown to other people. This is generally seen among cancer patients who do not want to disclose their illness to their loved ones. According to Kubler-Ross, an individual goes through 5 stages of grief, psychological reactions, after being diagnosed with the terminal illness. These are denial, anger, bargaining, depression and acceptance. The sequence differs for different individuals. However, the counselor must be familiar with these stages for helping the client to come out of his grief. Grief counselor helps the client to accept that death is the ultimate truth and an inevitable event. He also tries to minimize fears and anxieties associated with the terminal illness. This helps clients and their associated loved ones to vent out their latent feelings developed in response to the death. Problem-focused counseling. Problem-focused counseling gets its principle from psychoeducational and cognitive behavioral interventions. It mainly concentrates on coping skills and strategies that are required for living an effective life. The entire focus is laid on the current problems and anticipated techniques to solve them in an adequate manner. Counselor promotes minimum adaptable changes in the client to solve the challenges or problems. For this purpose, some insight is developed to look the same problem with different point of views or lenses. It also helps in managing cognitive distortions and / or any dysfunctional thoughts that may arise due to terminal illness. Supportive expressive counseling. One of the important goals of this counseling technique is to provide a supportive environment in which clients may express their negative as well as positive emotions and may learn to deal with their anxiety for uncontrollable events like death. This enables a person to tolerate various consistent and intrusive thoughts about dying. This form of counseling also helps clients in focusing on some important aspects about uncompleted and unresolved tasks. 15.16 Common approaches to counseling in terminal illness. Modern-day counseling techniques for the treatment of terminal illnesses are based on the principles of classical concepts like psychodynamic, behavioral, family and humanistic approach. Main principles behind these therapies were somehow different, but these can be modulated as per the needs of dying clients. Psychodynamic therapies. Psychodynamic approach is primarily based on the resolution of emotional conflicts and target the reduction of defense mechanisms, especially denial about the illness in the client. The main task of the counselor is to help clients to recognize their perceptions and defenses and help them to become emotionally stable and psychosocially functional. This therapy also helps the client to build better insight about themselves and their psychological states. Humanistic approach. The underlying philosophical roots of humanistic and existential approach is based on the notion of finding a purpose of life and giving it a literal meaning. This approach aims to help a terminally ill client to live his or her life to the fullest and face the death without any fear. Counselor helps the client to express hidden fears related to the death and if possible helps him /her to reach up to the self-actualization by building an insight. Behavioral approach. As the name suggests, behavioral approach is used for helping the client in gaining a perceived sense of control over his behaviors. It focuses on overt as well as covert behaviors. These behaviors are the direct result of maladaptive coping strategies that a client has developed in response to a terminal illness for reducing his stress and anxiety. Some commonly used behavioral techniques for reducing tension, fear, anxiety and distress in clinical settings are relaxation training, biofeedback, hypnosis and desensitization. These techniques are also helpful in controlling physical pain in somatic disorders having no physical root cause. Family approach. Terminally ill clients often develop a need of belongingness, love and affection especially from their family members. However, such needs remain unsatisfied and generate hopelessness, frustration and guilt in the client. Family members of the dying person develop a feeling of anguish and fear related to the death of the client. They may detach completely from the client. This affects their relationships in a severe sense which further increases negative impacts of a terminal illness. Family therapy intends to reduce the communication gap between family members by resolving hidden issues among themselves. This helps resolving dysfunctional roles in the family and improving harmony among them. Counselor tries to develop an understanding among family members how their behaviors and perceptions complicates the journey of client and offers a little or no help in improving his medical or psychological condition. Family therapy also helps in providing a closure to the unfulfilled desires, wishes and emotional needs of both family members and the client. It is often employed with several other therapies as an adjunct to provide a smooth road to recovery to the client. Points to remember: counseling in terminal illness. Terminal illness, a disease which is responsible for reducing the lifespan of an individual who may live perhaps up to some months or even a few weeks. Some prominent psychological symptoms commonly seen in clients with terminal illness are depression, higher levels of anxiety, and even rage and frustration. Counseling techniques focus on physical, psychosocial, emotional, spiritual, and practical needs of clients. Counseling techniques aim towards their self-fulfillment and resolving any resentments or conflicts. Common forms of counseling used in terminal illness are grief counseling, problem-focused counseling, supportive expressive counseling. Grief counseling, it is also known as the bereavement counseling. Common types of grief seen in terminally ill clients: normal, anticipatory, complicated and disenfranchised grief. According to Kubler-Ross, an individual goes through 5 stages of grief: denial, anger, bargaining, depression and acceptance. Problem-focused counseling. Entire focus is laid upon current problems and techniques to solve them in an effective manner. It also helps in managing cognitive distortions and dysfunctional thoughts that may arise due to terminal illness. Supportive expressive counseling. It is intended to deliver an emotional as well as social support to the clients suffering from terminal illness. Counselor enables a person to tolerate various intrusive thoughts about dying. Approaches to counseling. Psychodynamic approach to counseling. It intends to find a resolution of emotional conflicts and defense mechanisms. To build better insight about the root problems. Humanistic approach to counseling. The main focus is laid on finding the purpose and meaning of life. Counselor helps clients to express their hidden fears, reaching up to self-actualization and develop an insight and better social relationships. Behavioral approach to counseling. Behavioral techniques are useful for reducing the overall tension, fear, anxiety or any distress. Behavioral counseling aims to help the client in gaining a perceived sense of control over his body and mind. Familial approach to counseling. This form of counseling targets hidden problems and dysfunctional roles of family members. Client and family members are encouraged to express their hidden feelings and develop a congruence among them. 15.17 Counseling for psychological trauma. Psychological trauma, or simply trauma, is referred to the unique individual experience in which the ability to integrate emotional experiences is highly affected by an event. The event is perceived as a threat to the life support system and psychological integrity of an individual. It could be a natural disaster, physical abuse, an accident, etc. People with psychological trauma may experience several types of exaggerated responses like insomnia, intrusive and unpleasant memories and flashbacks, poor self-esteem and severe distress. These can be divided in 3 types of psychological trauma. Acute trauma. It is resulted from a single stressful event like a natural disaster or an accident. Chronic trauma. In this type of trauma, an individual gets exposed to repetitive traumatic events for a certain period of time, such as physical abuse or domestic violence. Complex trauma. It is also known as vicarious trauma. An individual gets exposed to multiple traumatic events. The effect of these events is cumulative in nature and is highly dangerous for the psychological well-being of an individual. For example, severe chronic child abuse. Professionals dealing with traumatized clients explain emotions as a luggage. When a client is exposed to a traumatic event, all these emotions are dispersed around various corners of the mind. Packing this emotional luggage is not an easy job. However, when a person tries to pack this emotional luggage, many emotions don't fit in so easily. As a result, they start coming out of the bag so often. Managing these emotions is very tedious, energy-consuming and stressful task which causes a lot of frustration. This results in several flashbacks, images and mood-related problems in the long term. When problems related to activities of daily life persist for several weeks after the event, then there is a possibility that the person may be suffering from post-traumatic stress disorder, PTSD. It is a well-known fact that almost 70% of adults experience some or the other form of the trauma during their lives. However, only 20% of them develop severe symptoms which may contribute to post-traumatic stress disorder, PTSD, or any other psychological disorder. PTSD is labeled as an anxiety disorder. The aftermath of the PTSD can lead to the development of various types of mental health disorders like drug abuse. There are several theories about how and why people tend to react to the trauma in different ways. Factors that play an important role in the determination of the responses of people to a traumatic event are personality traits like temperament, copying styles, previous experiences to any traumatic events, levels of perceived support and ability to understand about their behaviors and responses in certain situations. 15.18 Goals of psychotherapy in clients dealing with trauma. Reducing impact of traumatic event which is responsible for affecting emotional balance of the client. Restoring levels of self-esteem in the client so that activities of the daily life can be restored back to normal. To help the client in developing better coping strategies to deal effectively with the environment. To reduce the impact of the flashes and stressful and intrusive memories on the psychological well-being of the person to improve his /her psychosocial functioning. 15.19 Commonly used counseling techniques in psychological trauma. Trauma counseling is a patient-focused psychological intervention which is solely meant for treating the agitated emotional and mental states of an individual. For treating trauma and related psychological states there are some short-term as well as long-term modalities. Trauma-focused cognitive behavioral therapy, CBT. Thinking and behavior are directly linked to each other in human beings. In a traumatic incident, generally thought processes of a person are affected. Trauma-focused CBT assumes that emotional and behavioral outcomes in an individual are the direct result of one's thought processes and perceptions about an event. So, to change or modify emotional states and behavior, one needs to understand cognitions. It also includes helping patients identify their dysfunctional thought patterns, providing another trajectory for the alternative thoughts and rebuilding beliefs and self-esteem of the client. It helps the person to think differently and attach different meanings to the incidents. It is generally conducted over a short period of time, about 8 to 12 sessions. Counselor helps the patient to confront and overcome his or her fears and anxieties related to the traumatic event. Trauma-focused CBT includes mainly two types of techniques, i.e. behavioral, for example exposure to trauma-linked stimuli, and cognitive, for example cognitive restructuring. Cognitive processing counseling. Cognitive processing theory assumes that the client tries to understand traumatic events and develop distorted notions as a part of aftermath. These notions are then integrated to the prior schemas, which is known as assimilation. These altered schemas are then used to learn and unlearn things in life. This is known as accommodation. However, sometimes future learning is based on the distorted thought processes and altered notions and beliefs which could be detrimental to the psychological well-being of the patient, known as over-accommodation. Counseling helps the client in activating memory-based cognitive structures and identification of some maladaptive beliefs arising directly from the traumatic event. In other words, this counseling is based on cognitive restructuring, which is an integral part of the cognitive behavioral therapy. Prolonged exposure therapy. The main goal of the prolonged exposure therapy is to alter cognitive structures associated with fear so that they do not cause any trouble for the patient. This therapy works on the two main components, i.e. imaginal exposure and in vivo exposure. Imaginal exposure is all about present intrusive memories related to the traumatic event which were being avoided by the client. Client is told to re-establish these memories in present tense and inquired for emotional states attached to them. Then these emotional states are analyzed and understood by the counselor and patient for finding a further effective solution. In vivo exposure involves exposing the client to physical stimuli consistently until the attached fear and impact of the intrusive memories or flashback reduces up to a certain level. New information can be incorporated into cognitive structures of traumatized clients with the help of these two types of exposures techniques. They are quite useful in the treatment of PTSD and associated comorbidities. Imagery rescripting. As the name suggests, imagery rescripting is a technique in which client is told to reimagine traumatic incidences by using his imagination. He/she is told to look for other possible trajectories so that the impact of actual incidents can become less distressing. For instance, the client may be told to reimagine a traumatic event like the cyclonic storm Amphan that hit two states of Odisha and West Bengal in India, by scaling down the water and the stormy winds. This technique emphasizes that the memories after the traumatic incidents are just like ghosts. The counselor helps painting the picture in different colors so that it becomes less distressing for the client to live with his memories. Eye movement desensitization and reprocessing, EMDR. EMDR counseling was designed to reduce distress levels associated with traumatic episodes and incidental memories. It helps in accessing intrusive memories and brings them on the surface. These memories and experiences are then resolved to relieve negative feelings associated with them. During sessions, the main goal of the counselor is to remove obstacles in the path of mental healing by reducing physiological arousal and reformulation of negative beliefs. Counselor adopts some gestures like lateral eye movements along with various external cues, audio stimulation and hand tapping. Emotional Freedom Technique, EFT. Emotional Freedom Technique was derived from Thought Field Therapy, TFT. It includes tapping some points on the upper half of the body by a counselor. This technique is generally opted when there is a history of intrusive or unwanted touch. However, the literature is scanty and not many researches have been conducted so far on emotional freedom technique. Therefore, it is hard to conclude about the efficacy of emotional freedom technique. Points to remember: counseling in trauma. Psychological trauma is referred to the unique individual experience in which the ability to integrate emotional experiences is highly affected by an event. The event is perceived as a threat to the life support system and psychological integrity of an individual. Types of psychological trauma: acute trauma, chronic trauma, complex trauma. It is a well-known fact that almost 70% of the adults experience trauma during their lives. However, only 20% of them develop severe symptoms. Goals of psychotherapy in clients dealing with trauma: reducing the impact of traumatic event, restoring levels of self-esteem, developing better coping strategies, reducing the impact of the flashes and stressful and intrusive memories. Counseling techniques in psychological trauma: trauma-focused cognitive behavioral therapy, cognitive processing therapy, prolonged exposure therapy, imagery rescripting, eye movement desensitization and reprocessing, emotional freedom technique, EFT. Trauma-focused cognitive behavioral therapy. To change or modify emotional states and behavior, one needs to understand cognitive aspects in depth. It includes helping patients identify their dysfunctional thought patterns, providing another trajectory for the alternative thoughts and rebuilding beliefs and self-esteem of the client. Cognitive processing therapy. Captain assumes that the client tries to understand traumatic events and develop distorted notions as a part of the aftermath. Counseling helps the client in activating memory-based cognitive structures and identification of maladaptive beliefs. Prolonged exposure therapy. It assumes that traumatic events are usually followed by their emotional processing. This includes two techniques: imaginal exposure and in vivo exposure. Image rescripting. In this technique, client is told to reimagine traumatic incidences by using his imagination. It emphasizes that the memories after the traumatic incidents are just like ghosts. Eye movement desensitization and reprocessing. The main goal of the counseling is to reduce physiological arousal and reformulation of negative beliefs. It aims towards the reduction of distress levels associated with traumatic episodes and incidental memories. Emotional freedom technique, EFT. Emotional freedom technique was derived from thought field therapy, TFT. It is generally opted when there is a history of intrusive or unwanted touch. 15.20 Let us sum up. Special population is mainly comprised of those people who have been marginalized. They are the most vulnerable part of a society. Their need for love, affection, affiliation, respect etc. are often neglected due to various reasons which further deteriorate their health conditions and make their lives difficult with a feeling of guilt and frustrations. In geriatric population, there is a decline in the effective functioning of bodily parts or organs with the age. This is the most common root cause of many problems in late adulthood like dementia, delirium, depression, anxiety, loss of independence, higher vulnerability, sleep issues, and increased social isolation. Commonly employed counseling techniques for the treatment of these issues are cognitive behavioral therapy, reminiscence therapy, interpersonal therapy, psychodynamic therapy, and gestalt therapy. These therapies reduce their agony and frustrations and helps them in the management of their emptiness and affected emotional states. HIV/AIDS is one of the most debilitating and notorious form of disorder which decreases the overall immune levels in an individual. It opens a window for other types of infections, opportunistic infections, like tuberculosis and pneumonia. HIV/AIDS is also responsible for altering psychological states of an individual and causes some psychological disorders like major depressive disorders, bipolar disorders, substance use disorders, severe levels of stress and anxiety, suicidal ideation, and neuropsychological impairment. Some commonly used forms of HIV/AIDS counseling are client-initiated counseling, provider-initiated counseling, pre-test counseling, post-test counseling, crisis intervention, and couple counseling. These are very useful in decreasing the overall psychosocial impact of the disease and let clients live their lives with grace. We also studied about terminal illnesses which are responsible for reducing the lifespan of an individual perhaps up to some months or even few weeks. Some prominent symptoms of certain psychological disorders like depression, higher levels of anxiety, and even rage and frustration are commonly seen in terminally ill patients. For reducing the intensity of these symptoms, various forms of counseling are used. These are grief counseling, problem-focused counseling and supportive expressive psychotherapies. These are primarily based on principles of psychodynamic approach, humanistic approach, behavioral approach, and familial approach. Regarding psychological trauma, almost 70% of adults experience some or other form of the trauma during their lives. But only 20% of them develop severe symptoms like contributing to PTSD or any other psychological disorder. Some short-term or long-term modalities are available for reducing the harsh impacts of stressful traumatic events. These are trauma-focused CBT, cognitive processing therapy, prolonged exposure therapy, image rescripting, eye movement desensitization and reprocessing, and emotional freedom technique, EFT. Special populations are highly sensitive and susceptible to many hazards and prejudices. They are the struggling part of the society who need critical care and psychological management. All forms of counseling techniques mentioned in this unit are commonly used in clinical settings and are highly effective.